Hi, I'm Pat Marino, President and CEO of Facelift Mexico, the pioneers of medical tourism since 1994. Our first decade was successfully spent specializing in cosmetic surgery. Now, closing in on our second decade, we have realized how unaffordable spinal surgery is in the United States and Canada. And for a person without insurance, or even the underinsured, it's just an impossible amount for them to pay. So, after 2 years of research and vetting, we are proud to announce we have added a neurosurgeon to our team of board-certified surgeons, Dr. Mario Salmon, MD, FACS. Dr. Salmon is a fellow of the American College of Surgeons. And when you see a surgeon with FACS in his title, you know his education, training, surgical competence, ethical background are subjected to a rigorous evaluation by the college. One of his many specialities is the new artificial disc, ROTAIO. It is made by SIGNUS, a world-class German company that has a history of manufacturing and researching prosthetic devices for 20 years. It is truly a millennium miracle that the artificial disc postoperatively allows the patient to move their head up and down, side to side. Now, you may wonder, do I have to fly to Mexico for an evaluation with Dr. Salmon? The answer is no. Due to this world being so highly digitalized, you can send your MRI or your CAT scan, your medical records, to my Florida office. We have a special uplink that receives them. I then will send them on by email to Dr. Salmon, and he evaluates them. The next step is you and I will have a telephone conversation, and I will discuss with you the conclusions of Dr. Salmon. And remember, the cost of your surgery in Mexico with Dr. Salmon is 1/3 the cost of the surgery in the United States or Canada. Yes? 1/3 the cost, you heard right. We know you will enjoy your postoperative recovery at CASA Marino. It is private, it is deluxe, it is a lovely villa in San Miguel de Allende, and it is affordable. You will be pampered by our experienced staff, and Dr. Salmon will come there to visit you after you have left the hospital. Imagine that, a house call. Our Essentia Medi-Spa and Yoga Center is run by my daughter, Melinda. She lives at the villa and manages the property. How great, just roll out of bed for your massage. We are located in a lovely residential area of the magical mountain city of San Miguel de Allende, where the weather is spring-like most of the time at 6,000 feet elevation. After you leave the hospital, Dr. Salmon will come to Casa Marino for your follow-up. And now, I am proud to introduce Dr. Salmon.
Hello, Patricia.
Dr. Salmon, please tell me about your education and medical background.
Of course, be my pleasure, Patricia. I studied in one of the top 5 medical schools in my country, Mexico, which is called University Anáhuac. It's a private school there in Mexico City. Then, after finishing med school, I went to Hospital Juárez de Mexico, one of the biggest hospitals from the government, and I studied there for a year general surgery. Then I went to the National Institute of Neurology and Neurosurgery, also in Mexico City, where I did my specialization in neurosurgery. There we have training in brain and spine surgery, also microsurgery, laser surgery, the use of ultrasonic aspirator, and all the technology, because it's one of the biggest hospitals in neurological surgery training in my country. I finished there in 1993, and then I moved out from Mexico City to the city of Celaya in the center of the country, where I've been practicing neurosurgery for the last 19.5 years. Now at this time, maybe I'm almost over more than 2,000 procedures in the last 19 years. I'm working at the General Hospital in Celaya, also in Querétaro and in Celaya, doing my private practice since then, with, thank God, a lot of success.
Dr. Salmon, please tell me, where do you perform your surgeries?
I prefer always to look for hospitals who can offer the best of best in treatment for patients and technology. So these hospitals in Celaya are Hospital San Jose de Celaya, Hospital MAC, and Hospital Guadalupano, which I've been operating in these hospitals. I'm on staff of these hospitals and also hospitals in other places like Querétaro, which is near, and also in Mexico City. I'm accredited for working in any hospital I want in my country because of my board certification, my being a fellow of the American College of Surgeons, and all the degrees I have. I am recertified by the Mexican Board of Neurological Surgery.
Dr. Salmon, please tell me the type of anesthesia that you use during your surgeries and are MD anesthesiologists used during your surgery?
Well, of course, that's very important to know. When I took a patient in my hands, I always want to offer the best, only the best. And my anesthesiologist is board certified.
Please tell us about the new artificial disc and how it allows the patient natural movement, unlike the graft and fusion.
Maybe 20 years ago or 30 years ago, when the spine surgery started to grow, a lot of people, a lot of doctors, orthopedic surgeons or neurosurgeons, always were thinking about fusion, about stabilizing by fusion the spine, lumbar spine or cervical spine. But as time goes by, they started to see that this fusion caused problems in the moving segments above and below that fused segment. So they started to release or to invent these prostheses which preserves movement. Now ROTAIO has become with this new design, which the last 8 years maybe have been improved and with beautiful results.
Thank you for watching the video, and please feel free to call my Florida office. I'm available to speak with you, and I do answer all of my phone calls personally. Thank you.